Dr. Dhiraj of the Health Connection Group, please. Thanks.
Good afternoon, Chairman, members, and everyone here. Today I'm here not only as an ethnic minority, but also as a public healthcare professional, and as well as from the side from medical translation and interpretation. I would like to tell you that I'm not only worried about ethnic minorities, but also I'm worried about the health burden of Hong Kong as a whole. The reason is that health is a very important aspect for our city, not as only for the ethnic minority. But what I see is that we have a huge gap in health promotion here, especially when you look at ethnic minorities. What we see is that the media, as well as there are other channels that has not been utilized properly in terms of the dissemination of health information and health promotion. We have Center for Health Protection, but then the information that is provided in Center for Health Protection's website, wow, we have a problem with the language there. It's very sad to see that the language that is provided in CSP website, most of the language in what we can see there, either it's very academic to be understood by the layman, or is simply as a machine translation. It's just you input everything in Google and you come out with this translation, and I don't know who is there to check it out, but it's kind of published on the website. And it's very sad to read that is not readable at all. And the second thing that I also like to put out is about the information about the cultural sensitivity training. Now, as a health connection, what we are trying to do here is that we are not only trying to connect this language gap, we're also trying to connect the culture gap between the healthcare providers and the ethnic minority people in the community. What we see is that because of the lack of cultural sensitivity and cultural competency, there's a huge problem, not only for the in terms of eating and wearing, but also in terms of other cases, for example, in terms of mental health and psychiatric counseling. Likewise, when we talk about medical interpretation, yes, what we see is that we do need interpreters, but do we have competent medical interpreters? Do we have proper trainings for them? But also at the same time, what I would like to focus on is that we need to train our healthcare professionals about the roles of interpreters. We are not here only to connect the language. We are also here to maintain and tell them about this is the culture, and then we need to be the cultural broker. So interpreters are supposed to be linguistically as well as culturally competent, but what we see is that the healthcare professionals are not aware of that. Last but not the least, what I see is that we have so many ethnic minorities who are interested in health services. We have also so many people who have this kind of background from healthcare services. But having said that, when they come here in Hong Kong or when they grow up here in Hong Kong, they end up doing some other jobs that is not related with their profession. So I would like to say how we can help these people and how we can work towards making not only healthy ethnic minority, but healthy Hong Kong in future. Thank you.
Thank you, Dr. Dhiraj.